Welcome. I'm Dennis Quaid. The integration of science, technology, and medicine continues to reshape the way we manage our health. Join me as we take a look at some of the leaders in these fields who are changing modern medicine and creating an opportunity for a better future.
Suddenly faced with a global pandemic, Americans depended on the healthcare industry more than ever before. The need for skilled, highly prepared, and staffed hospitals became our most important means of survival.
Like the rest of the world, we began to hear about the start of the pandemic. We all took a look at everything that was going on, so we learned daily. Our first steps were that we did a lot of training with our staff to keep our employees safe with personal protective equipment. And we also took a look at all the evidence-based treatment protocols so that we were able to successfully treat the patients.
Early on in the pandemic, we were really in it, in the fact that we were 4 hours from the epicenter of New York City. What we did see was a decrease in the amount of people trying to get to their family doctor, get to the emergency room. So there was a dramatic reduction in volume. And when you do that with comorbid conditions like congestive heart failure, diabetes, and COPD, these are things that need maintenance all the time so they don't turn into acute problems. And so you had no one coming, and then all of a sudden COVID started upticking. And as COVID upticked, these comorbid problems were brewing and brewing and brewing. And all of a sudden there was a flood of people that would normally never be there. It was an incredible, intense time. We're going to see an uptick in our cancer rates in the next 2-3 years, which is incredibly concerning to me because there's going to be more burden on our healthcare system dealing with this population, yet we're going to be in one of the greatest healthcare crises, which is going to be a lack of staffing.
While panic, fear, and misinformation began to spread, healthcare heroes jumped into action, saving lives as cases grew. With so much outside uncertainty, healthcare facilities and their staff made it their goal to ensure that patients felt as safe and comfortable as possible, caring for them with competence, compassion, and empathy.
I sort of made this comment one day in one of our huddles saying reopening is going to be harder than closing. We recognize, again, that ripple effect that we need our population to be healthy well after this pandemic. And how are we going to accomplish both of those things? We still have acute care that we have to do, where we have all of these people who have delayed preventative care. And that's where we've really used resources like telehealth and telemedicine. And again, talking with our community providers, saying, this is where we are. This is what we're going to be able to do. Let's work together to prioritize getting people back to the services that they need and use the resources that we have. We're now in an environment where we're living with COVID within our building, and that makes it a risk for people to come here. Throughout the pandemic, we have never stopped hand washing, masking, social distancing. We've messaged to our community, we're going to be safe. You can come here. We're going to have those things in place.
I don't want to see what happened in the first wave where people were afraid to come and get health care. We need to continue to do routine physicals. We need to continue to get our colonoscopies. We need to continue to get vaccinated and do our well child checks. All of that is still going on. Everything that was good from preventative care still needs to happen.
We obviously support vaccination. We encourage it. We were a vaccination site. Initially, as soon as we'd roll out vaccines, our schedule would fill up within 1 hour, and we were doing 250 vaccines a day.
Vaccines will probably go down as one of the greatest innovations in modern medicine and maybe in all of mankind. We don't hear about polio or measles or mumps, so vaccines are incredibly effective. We know that's true of all the COVID vaccines that are available to us now. They have done their job incredibly well. They have reduced hospitalization, reduced morbidity, and reduced death. Vaccines have been the absolute single best way to mitigate and reduce the burden on healthcare systems throughout this country.
We hope this program has served as an inspiration to you. Be sure to join us next time as we continue to profile the people and ideas changing the way we live. I'm Dennis Quaid.